Welcome back to the Humble Healer podcast. And today I will talk about a topic that is one of my special interests, not only in medicine, but in helping patients not in healthcare. And it's about burnout. And I've spent a lot of time for the past 10 years learning about burnout and how to help doctors, nurses, and other healthcare professionals to deal with burnout and also provided peer counseling sessions for also multiple healthcare professionals at multiple different levels in healthcare. And it's always been very rewarding for me helping those that may or may not be in crisis to help them find a balance, not only between work and life, but also in their wellness, and to be able to manage, achieve a cure for burnout. And I was interested in this because I learned about the high prevalence of burnout among healthcare professionals, and it really affects certain specialty, especially emergency medicine. And I do have a lot of emergency medicine physician and also PAs, physician assistant, and nurse practitioners coming from the emergency medicine setting that are not very conducive to wellness and professional fulfillment. So a lot of these excellent clinicians have joined us at the urgent care clinic since they felt burnt out at the with the say broken emergency medical care system that we have right now. I can go on and on about the negative effects of burnout among healthcare professional, but also among several patients that I have seen during my work days. So this is an important topic for me in trying to put everything together that I've learned in order to help patients in the community out there. And I come up with this program that is about 3 months in duration. And we have a lot of things to work through. And if the patient is willing to spend the energy and time to work through this, I strongly believe that at the end of the 3 month program, you'll be able to achieve not only a cure for burnout, but also a sustainable, professional, and personal fulfilling lifestyle and wellness. So there are a lot of resources that are available on the Humble Healer podcast, and I will go over specifically which episode will be applicable to certain topics as part of the program. And every 2 weeks, I'll be calling the patient for a half-hour conversation. We go over what have been achieved and what else can be done. And then in between the sessions, I'll be giving out homework and resources for the patient to work through it. And just like anything else, this is hard work, but the goal is to cure burnout and to find that happiness and contentment in your life, regardless of what you do. And many people, including in healthcare, have not been able to achieve that despite going through years and years of education and still not being able to find that balance. And it's really got nothing to do with how smart or brilliant you are, because there are so many brilliant professionals in medicine, but yet they still struggle with finding that balance and fulfillment in their career and their personal life. And that's where I feel like I can bring my knowledge and expertise in this topic to help everyone. And so this program will start with a short stress video review, and I have three cartoons that only last 2 minutes each. And that'll be good to go over how to show that high stress state is a result of a dominating fight or flight system when it's not in check. And this system should only be activated in life-threatening situations. And there are about 17 hormones of this system that exert these harmful effects. And countering the chronic stress response and activating the rest and digest system is one of the goals in this program. And learning how to do this on a daily basis also help you achieve good health, happiness, resilience, and longevity, but also give you a good work day. And when I apply this at work and stay in the rest and digest system, it allows me to feel not exhausted, mentally consumed, and physically consumed at the end of my 12-hour shift. I would be able to go for another 12 hours if needed. So it's so important to be able to maintain your functional state in the rest and digest system, not only long-term, but short-term, to be able to find professional and personal fulfillment. And the main hormones in this system are acetylcholine, which is like a brake fluid, dopamine, reward system, oxytocin, loving, cuddling hormone, melatonin, sleep and rest, and endorphins, the feel-good hormone. system is your friend on our daily lives where there is no emergency situation. There are many ways to keep the rest and digest system activated daily. Physical activities increase both deep breathing and reduce muscle tension, both of which keep the rest system activated while improving lean body mass, burning fat, reducing weight, blood pressure, heart rate, and blood sugar for diabetic patients or non-diabetic patients. Yoga, meditation, Tai Chi, Pilates, Qigong all can activate the rest system and reduce injuries from workout and other physical activities. Social support is important based on the practice of kinship and building connection with everyone and every social encounter. But it starts with self-connection, and that starts with a self-compassion practice. So episode one, my very first episode of my channel, is focused on self-compassion because I think that's a very important topic. Now, the journey of wellness for self-compassion is not complete without practicing self-compassion. Respond to your mistake and suffering the same you do with the people that you love and care about. Show yourself some compassion. Self-compassion provides us with a kinder, healthier, and more helpful alternative to self-criticism. Develop a useful model of how to show compassion to ourselves by thinking about how we would show compassion to a loved one in distress. If you slip and fall on the ice, acknowledge the mishap and check to see if you are okay. Instead of calling ourselves names for having the mishap, learn to tell ourselves that mistakes happen. And this could happen to anyone. Stop and be mindful with ourselves when mishap happens and do those two things. Then respond with kindness and care. Self-compassion is one way to practice self-connection besides self-love and self-acceptance. Connection to others is the antidote to all stress, anxiety, substance use disorders, and connection to others have to start with self-connection. One cannot keep pouring from an empty cup. One cannot extend positive energy that one does not have. Practicing kinship with others around you also is very important for your fulfillment. Your spouse, your partner, your children, your pets, co-workers, clients, patients. Investing in your relationship, both at home and work, help improve both personal and professional fulfillment and provide a cure for burnout. The next step is to prioritize one's wellness once you have incorporated the practice of self-compassion in your daily lives. I have one episode that provides exercise tips and another one that provided dietary advice. Another one also show a strategy on how to turn health wellness New Year resolution into lifelong resolution. Burnout and stress resume one's wellness routine drops off as it happens so often. Spiritual practice. This does not happen to be religious. I have several episodes discussing how practicing joyful living principles can bring so much happiness and contentment to our lives, no matter what life throws at us. The use of mindfulness can also provide significant relief for those struggling with stress, anxiety, and panic attacks. As one particular episode also discussed about how to prepare yourself so that you will almost always have a good day at work. For those who need these life coaching sessions, these are essential since a lot of those folks overwork and lack life balances in the first place. Another episode we'll dedicate for this. Episode 41 provides sample meditation messages for those who choose this meditation to help bring a restful night's sleep. The myth of work-life balance. Focus only on work and life can contribute to increased burnout among those juggling to do well, both at home and at work, and completely neglect their own personal wellness, including physical, mental, spiritual wellness, as well as financial wellness. It's important to incorporate those in your life balance. There's a book that's called The Myth of Work-Life Balance, and it talked about that. Longevity is also one important focus on these life coaching sessions, and we talk about how to detect factors that can increase risk of sudden cardiovascular death or severe disability. So I hope that you find these episodes helpful, and reach out to me personally if you want to take part in these life coaching sessions, and I'll be happy to travel this journey with you. And hopefully, I'm confident that we'll be able to achieve our goals in 3 months if both of us do our jobs. Thank you and take care.